Let's talk the COVID-19 vaccine. We are elbows deep in our state's biggest, most involved health effort ever to combat this virus. So far, 551,000 doses have found their way into Utah arms. Vaccines are available at this point for people 70 and older, healthcare workers, first responders, educators, and people who live in or work in long-term care facilities. But that list is growing very soon. More people will be eligible to get a dose beginning March 1st. Joining me today to tell us more, talk about the latest in vaccines in Utah, Dr. Audrey Stevenson, the Director of Family Health at the Salt Lake County Health Department. Good morning, Dr. Stevenson. Thank you so much for your time.
Good morning.
Can we start with yesterday's snowstorm? Have those snowstorm caused any snags or delays for you guys?
It most certainly has. We've noticed that a number of our health districts around the state have had delays in their vaccine arrival, and so as a result of that, many of the appointments that individuals had for yesterday and today had to be canceled.
Okay, got it. Can you talk to me about the response there? Some of those are being rescheduled for this weekend. Some are just being pushed back. Is that right?
That's correct. In part due to the weather yesterday, many of our health districts had to cancel many of our events. For many of us, we've rescheduled those either to this weekend or to early next week.
Okay, and I understand health departments are communicating with people mostly via email, so we just want people to make sure they check their emails for those rescheduled appointments.
That's correct, or call your local health department for more information.
Moving forward here, can we transition to the list of people eligible for the vaccine? I understand the people eligible expanding March 1st. What can you tell us about this point about who will be eligible beginning in March?
Well, we're anxious to hear the same thing. We understand that there's going to be a press conference from the governor later this morning. And at that time, we will probably get more definitive information about who's upcoming in that next priority group. Okay. Right now, we're focused on making sure that we've offered the vaccine to all of those individuals in those prior priority groups. And that also that we're really focusing in these last few days on those 70 plus, because we know that we have not reached all of those individuals that are currently eligible to receive the vaccine. Moving forward, we anticipate that we'll probably see the next priority group to be those 65 years of age and older.
Understood. So we'll be getting more information about those eligible in today's press conference with the governor.
That's correct.
Okay, so 65 and older, we've heard rumblings that means some health limitations, but we're not sure what those are yet. Does more people, so expanding that eligibility, mean more supply? Or the number of doses we're getting weekly going up?
That's what we're hearing from the federal government. Is we're hearing that, especially with the introduction of additional doses that have been ordered both from the Pfizer and the Moderna, but we're also hearing that Johnson & Johnson, with that emergency use authorization, may increase the number of vaccines available for us for distribution. We look forward to that.
Okay, and Johnson & Johnson again has emergency use authorization from the World Health Organization, not yet from the FDA, is that right?
That's correct.
Okay. We saw significant challenges scheduling an appointment at the beginning of this process. What have you guys done to respond to those challenges? How do you want people to go about snagging an appointment now?
So moving forward, many of our health districts have anticipated that there has been large demand, and in many cases more demand than there have been appointments available. Moving forward, at least in Salt Lake County, we're introducing a new scheduling system in the anticipation that we may be able to refine that process and make it easier for individuals to be able to get an appointment moving forward.
Okay, so really the message there is patience, unfortunately.
Correct.
Okay. Dr. Audrey Stevenson, the Director of Family Health at the Salt Lake County Health Department. Thank you so much for being with us this morning. Appreciate your time.
My pleasure. Thank you.